My name is Gloria Milimo, and on this episode of Heath Digest, we look at how health information system is helping improve the quality of care in health facilities. Experts say the digital revolution has taken different sectors to new heights through the advancement of technology. As they continue to dive deeper into technology and its various branches, in health, it's playing a vital role in clinical workflow solutions. These are increasingly becoming essential for hospitals and health centers. In state institutions, there is need to improve the quality of services offered and help counter errors. The current situation is compounded by labor shortage in the country's health sector. Hence, the government is leveraging use of integrated digital health platform dubbed AFYA-KE to ensure health facilities go paperless. This decision comes on the backdrop of healthcare being overwhelmed by heavy paperwork and manual processes that force service providers to spend hours each day transferring written patient information to their counterparts while handing over to their colleagues during shift change. According to experts, this only eats into the time that could be spent focusing on direct patient care. It can also leave room for mistakes, which they argue account for at least 50% of medical-related issues. This facility at the University of Nairobi is a new dawn. The patient-centric information system has revolutionized its operations.
Good afternoon.
Good afternoon.
You want to be seen?
Yes, I'm seeing a doctor.
Give me your payroll number.
Staff payroll number?
Yeah.
Okay.
Can you have a seat? You will see, you will be called by the nurse.
Okay.
After that, you will be queued to the doctor.
Okay.
Yeah.
Thank you.
Thank you.
The health facility handles between 200 and 300 patients each day. Initially, patients seeking services would be forced to contend with long waiting hours as the health workers processed the huge number manually.
The queues could be very long because of the time taken due to the manual processes. The other thing that has happened is we are interlinked. We have satellite clinics. The system has interlinked us all. So even if a patient is seen at at one of the satellite clinics, we are able to view that from any other point of management. And we are able to do for the patient as required without necessarily carrying any form of paperwork from that unit to wherever else they have been referred to.
Officials at the facility's records department would be forced to retrieve patients' medical records from the shelves for the doctor to be able to know their history, clinical findings, diagnostic test results, among other crucial information.
We have a record system. We have a record unit where when patients came in, would have their files retrieved and then go to triage for the nurses to do the observations, after which they are entered manually into their files, after which the patients now are taken to clinicians who also do all their records, used to do their records in their files, after which the doctor would do prescriptions on paper and also do any other requests on paper, which will go to the various sections after that, where everything used to be done more or less manually.
The manual system of record keeping, according to experts, is not only inefficient but also labor-intensive. The need for a seamless integrated system that increases the bandwidth of caregivers while also enhancing the quality of care by reducing medical errors has never been so welcome.
Number one, it is slow because the record clerk has to look for those files manually from the records and then deliver them to the nurse's station for triage. The nurse has to carry the file manually to wherever they want the patient to be seen from. So it used to be very, very difficult and also taking a lot of time. Currently, what happens is the patient reports at our record. It is entered into the system. The system will, the nurse from records will notice all the records for patients who have been keyed in. They are able to take observations and put in the system and send the patient directly to the clinicians or wherever they are required to report. And the clinicians only records in the system and sends the patients to the various units where they are supposed to go. So nothing, they don't need to carry any paperwork, and our records are all in the system.
From the records department, where the patient's information is fed into the system, it is queued to the triage station, where nurses obtain the information and administer the necessary tests required at that point.
How are you today? I'm fine, thank you. How are you? Good. Thank you.
We're going to check your
Okay.
Sit there, please. Get relax.
Results at the triage section are also keyed into the system. Here, the patient is subjected to tests ranging from blood pressure, oxygen circulation, weight, and also temperature.
When we were using the file system, it is possible for someone to actually break off some papers or even hide patients' files when they have their own agenda. However, it was not a major problem, but those are challenges that we used to experience once in a while.
Later, the doctor is able to get the patient's information all the way from the point of entry.
I had come and I had a cough.
Okay.
Yeah, so I've gone through the triage, so they told me to come and see the doctor.
Yes, I can see your vitals, they are clean. For how long has the cough been there? Any medication you've taken before?
No.
Any chest pain?
No.
Any headache, fever?
No.
Okay. Any history of asthma? Been treated for TB?
No.
From the routine questions asked during the diagnosis stage, they are able to recommend the appropriate tests required and medications needed to relieve the patient of their symptoms. But in many cases, patients are required to pass by the laboratory for further tests before a definitive diagnosis is made. The procedure ends at the pharmacy, where the patient goes to pick their prescription, all this while without having any single written note from the doctor. All this thanks to connected technology that increases productivity and level of care delivered to patients. As well, the digital integration enhances patients' experience to receive high quality and accurate care.
We realized that we did not have the need of our patient at hand. So we tended to procure drugs based on whims and what we thought was necessary. And therefore we had overstocking. We had overstocking some drugs and we had severe shortage of others. And that meant that most of the prescriptions that were being given to patients ended up being bought over the counter, which was very expensive, as opposed to when you buy these drugs in large quantities. So this system helps us to now understand the nature of our requirement, even going by the seasons, because some diseases are more prevalent during particular season. And therefore we can be able to ensure those drugs are available when they are needed.
Is activated to be attended in the university.
Clinical workflow solutions like the Afya KE platform enables these facilities to become central hubs for storing and retrieving patient data.
Now we are able to generate data. We can even generate data on a daily basis, and we are able to tell numbers without necessarily having to go back to counting how many patients were seen and the like. Number two, it is also possible to tell the kind of problems or diseases that were seen on any particular week or any particular day.
With this, an efficient IT infrastructure is paramount to assure proper management of the data, to ensure it is fully compliant with cybersecurity, patient data privacy, and data integrity rules and regulations.
We employ a myriad of measures, starting from the rudimentary one of physical security, where we ensure that our data center is securely, physically safe. And then we do what we call a demilitarization zone, whereby we start by ensuring nobody can access our data. And then we allow only those who are authorized to access. And therefore we filter out any unauthorized access. At the user level, we also train them to ensure that any data they are accessing, they know that they are supposed to keep it safe and secure. Of course, we are talking about medical data here. And therefore, they need to make sure that the data is protected from any unauthorized amendment or any unauthorized access. And they also need to ensure that the data that is captured at the end is captured in the system, not using other systems. So what we did is we procured gadgets and we configured them, including with the necessary, antivirus. You realize that health records are managed by many people. You realize that when you fall sick, you go to your nearest facility, not necessarily to the one you regularly attend you. That record will become disjoint and it will not form part of your record system. But with the AFYA-KE record system, it is envisioning a situation whereby no matter which health facility you go, your record will be aggregated into one digital record. And therefore, even in the case of emergency, whichever doctor is able to, whichever hospital you're able to go to, and whichever facility, they will be able to pick your record and be able to see your history and be able to treat you.
Similarly, the data is also hosted within the government's data center. This is in line with the Data Protection Act of 2019 that classifies health data as sensitive.
The university is a registered data controller and data processor. So in this case, we are data controller because we collect data as a primary subject. So from the primary subject, and we store it. This data is stored in our data center. Our data center is a tier 3 data center. So in technological terms, that means that is a data center with the necessary redundancies and replication to ensure that that data is available whenever it is needed, and it is preserved in the manner it is required. And it has the necessary protection to ensure that data is protected from cyber spoofers.
Generating data from the AFYA-KE system is very easy, and one is able to even analyze that same data on a regular period as required. We can do data analysis per week, even per day, or even per monthly, whichever way we want to analyze that data. We utilize data to advise us on the way forward. For an example, the medications we are buying, we are able to tell what is moving too much, and when we know we are able to tell our stock levels, and so we are able to maintain good stock levels as required at any one moment. We are also able to tell that there are certain products which are not moving that much, and so we also bring that the purchase of some of those products on the lower scale.
We have the consultation, we have vaccination.
As the medical fraternity continues to leverage technology in various ways, there is no doubt that embracing the latest digital technologies have ushered in a new era of healthcare where patients receive more precise care. This also ensures that caregivers become more efficient and productive in facilitating an environment that promotes universal health coverage. Gloria Milimu, KTN News.